Hi, I'm Zach from CoreXL. Today we're going to show you a magic exercise that we use in order to fix multiple injuries in the hips, legs, and lower back. And before we show you the exercise, we're also going to show you the anatomy so you can understand why this exercise is so effective at healing multiple injuries. And now we're going to show you a testimonial from one of our clients.
Aaron Judge down 0-2 and a swing and a miss. Trevino wipes him out. Talk to me.
My back's been off and on bothering me this past year. Obviously it was sometimes when I was pitching, it'd flare up. When I'd stand around, especially during BP, you get really tight.
So you've been here now for 6 sessions, and how much better does your back feel?
Well, it's night and day difference. My back feels much better than it did when I got here.
No pain now when you're throwing?
Yeah, no pain whatsoever. Feel good, feel strong.
So we're going to go into the anatomy now, and then we're going to show you the exercise. So I've hidden the glute max here on this side, this muscle here, okay? So what we're looking at here is the glute medius. We're going to be working that, but the main thing and concentration is we're going to be working this. And look where this hooks, right into the front of the hip. So it's going to immediately rotate the hip. It's going to internally rotate the hip forward. Okay? If this is weak, what happens is this is your main medial rotator. So if this is not functioning and strong, the lateral rotators have to start overworking. So lateral rotators, and they all work as a unit together, but this is your main lateral rotator right here, your piriformis, and it works with these muscles here to laterally rotate the hip, to take it this way. And another lateral rotator is your bicep femoris, okay, and also your sartorius. So when this is weak here, then all 3 of these start having to overwork. And this is what causes the compensations and starts causing the irritation into the hip flexor, okay, and starts causing the pulls into the bicep femoris and also the tendinosis here. And the final thing I want you to understand is the IT band, the TFL, okay, this chain here. This is like your bridge muscle for internal rotation and hip flexion, and this also starts getting irritated and taking over, all because the glute minimus is weak. The last thing I want you to understand is low back injuries and how the medius and minimus apply to that, okay? Look where this hooks, right to the top of the crest here, the hip, okay? And look where the erectors and the internal oblique, okay, look, and external oblique, they all hook up here. So if this is dysfunctional, okay, through here, and if we hide this, also this minimus here, okay, look, that's a huge support structure for the hip. So if this hip becomes unstable here, it's going to put a lot more stress onto the erectors here. And this is also going to cause a lot more stress onto your disc and cause herniations and stress out that piriformis, which leads to that sciatic nerve right there overworking. I just want you to bend your knees back at 90 degrees and then just move them forward just a little bit, okay? So your ankles are going to be ahead of your knees slightly, but you don't want to get out into this position here. Then you're going to take the same position with your hips as the dangler, okay? So pop your hips forward, arch your back, try to make sure your hips are completely level. So if we're looking at it from here, okay, right here. So now we're going to show you the start point of the exercise, and all you need to do is, this is a soccer ball here, you get a soccer ball, basketball, and you can also deflate it in order to make sure that when you set up here, you want the knee, the top of the knee here at hip level. It can also be slightly above, around there to start, okay? And what this is going to do is we're going to take adduction out of the equation here, and we're just going to focus on medial rotation here, and that allows us to really concentrate on developing the minimus first. Once you have the strength in the minimus, then you're going to have no problem being able to do this and add in then the medius and more adduction. Because what we're doing is with this exercise, we're adducting and then we're medial rotating, and that adduction really puts the stress onto the medius, and when we do this, that puts more of the stress on the minimus, more internal rotation. So real easy here, put the ball here, okay? You're not squeezing the ball, just put it there, just let the leg relax on it. Get up on your elbow, pop the hips forward, chest back, form that C shape, arch your back. The toe is pointed down. My big toe here, okay, is right in the center, okay? So it's not back here by the ankle, it's just right in the center of the foot. It's just touching very lightly. So just to be clear with the setup, okay, when you're setting up, the ankles are slightly ahead, okay, of the knee here. But when I put this toe with this top foot, when I put this toe here, this top ankle here is in line with the knee, and I'm forming a 90-degree knee angle. And then you're just going to lift. And only lift as high as you don't feel it into the TFL. So if you feel good, take it all the way up then the ankle to knee level. If it feels more TFL-ish, take it a little bit lower and just develop it where you can feel it back into the butt and not into the TFL. And it's that easy. And look at the toes always pointed down. Don't let your legs get out here too much too. Make sure that ankle is right in line with the knee, and then hold it for a 2 count. Feel that glute work. A mistake that people make when they're doing this is when they come up, they'll roll forward like this with the ball. So they'll go here, okay? Make sure that your knee, if I had a ruler right here, they'd be level. See how it just stays right in line. Also, if you're feeling really tight on this, okay, you can take this bottom leg and just move it forward like a quarter here. And this way, look, I can drop the leg now, okay, a little bit lower here, and now I can keep the range of motion even lower, okay? So that might be a better start point for you, and you can play around with that. So before moving on to the advancement, the goal is going to be to basically keep that toe pointed down, get this at the ankle to the level of the knee, and be able to use a 2-pound ankle weight and not feel any compensations in the TFL. And then you know that you're ready for the advancement. If you want to learn the advancement to the exercise and also how we test this exercise with weight, okay, and you can see this for free of charge, just go to the details of the video and click on the web app that we have there. And then you're also going to see other sample videos that we have on other exercises to fix your upper body, your lower body, and also your core. And we call this Corrects 12. 12 exercises to fix your entire body. And now we're going to compare the toe clam to other PT exercises. And this is the problem with the regular clam here, is that it just becomes extremely piriformis dominant because it's involving the lateral rotation at the same time it's involving adduction, and there's no medial rotation. And so what happens is you just start overtraining the compensations, and it doesn't eliminate injuries, it actually makes you more prone to injuries, in my opinion, what I've seen.